1. Would the clerk please read that item into the record?
Chair Hart and members of the board, departmental item number 1 is from the County Executive Office. It is a hearing to consider recommendations regarding a coronavirus disease 2019 COVID-19 update.
CEO Miyasato, or is Ms. Anderson or Dr. Dorenoso going to start us off?
Thank you, Chair. I'll be Dr. De Reynoso.
Good morning, Chair and members of the board. I am happy to be here to give you a somewhat lengthy report on data. And today's briefing topics include a presentation, a synopsis of our results from our countywide demographic data. We will also be covering the results from our demographic survey of the Santa Maria cases, as well as giving you a brief status on our monitoring project, or rather the state's monitoring project of our county, as well as provide information that your board has requested in a previous meeting. So to begin with, I'd like to introduce you to Ms. Joy Kane, our senior epidemiologist, who will be presenting on our countywide demographic data.
Thank you. So to start, we're going to, first, can you go back one slide? Oh, sorry. So to start, we're going to look at our confirmed cases that were interviewed by race and ethnicity through May 8th, and there were 443 of those individuals. And this first graph shows the race ethnicity, and 68.1% were Latino or Hispanic. As you can see here, in blue are the race ethnicity of our coronavirus cases, and 68.1% of our coronavirus cases are Latino or Hispanic. In comparison, 48% of the Santa Barbara population is Latino or Hispanic, indicating an overrepresentation of Latino Hispanics with coronavirus. Next, we looked at categorized census tracts by percent living below the federal poverty level. The area poverty level with the highest age-adjusted rate was 20 to 30%, and that had an age-adjusted rate of 141%. The next slide is looking at hospitalizations of those that were interviewed, and 89 of our coronavirus cases interviewed were hospitalized, of which 56.2% were Latino Hispanic. There were a total of 7 deaths recorded during this time, of which 71% were Latino or Hispanic. In summary, looking at our confirmed cases as well as deaths, we see higher numbers and percents among Latinos than whites. When hospitalized, acuity as well as the length of stay in the hospital is higher among Latinos in comparison to other groups. There's a clear association between lower income and increased rate of testing and confirmed cases. More persons with lower income are seeking out testing and are testing positive. The initial coronavirus cases interviewed by the Public Health Department mostly had private insurance. This may indicate those with public insurance, and those who are uninsured are not being tested. And there's a relatively low death count in Santa Barbara County as of that time. So some strategies. One is to ensure access to testing for those in highly impacted communities. Also to integrate testing with care coordination for highly impacted communities. To facilitate access to other supportive resources, continue to support local national policies and alleviate the burden of this disease and promote more equitable investment in our communities, and to provide more inclusive data collection, reporting, and deeper analysis to understand the unique risk and preventative factors among highly impacted communities. Also to continue with contact tracing and tracking, and to strengthen and tailor communication strategies to increase the access and conduct more robust outreach, education, and community engagement. So some next steps for the Public Health Department include ensure those at high risk with coronavirus have access to health insurance, primary care, and safety net programs, as well as to continue to expand testing communities at risk for coronavirus. And if you check out our entire report, there's a little bit of additional information which I wanted to highlight, including the % of confirmed coronavirus cases by race, ethnicity, and age group, confirmed coronavirus community cases by census tract, poverty level, age-adjusted rates, confirmed coronavirus community patients hospitalized by race, ethnicity, as well as ICU admissions, the length of stay of hospitalized community coronavirus positive patients who have been discharged by age group, and the % of Lompoc federal prison coronavirus incarcerated cases by race, ethnicity, and age group.
So this detailed report will be available on our website. I'd like to pause here to see if your board has any questions about what Ms. Kane just presented.
Thank you very much. Supervisor Hartman has a question.
On slide number 8, I'm a little confused. It says that there's an association between lower incomes and increased rates of testing and positive tests, and then public insurance that people aren't being tested. So is it low income with private insurance, or it seemed to be a contradiction?
Supervisor, through the chair, we would have to investigate that a little bit further. What we did see is that lower incomes had increased rates of testing as well as increased confirmed cases. And then we also saw that there was some association with insurance status as well. So we can go back and review that in more detail.
Right, and just to be clear, that we do have testing available that people don't have to pay for, right?
Correct. At our 3 community sites, which will be available through the end of July. And the department intends to continue some form of community testing without the ability to pay as a barrier.
Supervisor Williams?
Well, I want to, ask you to sort of make a gut call or not necessarily, make a conclusive answer to this, but there seems to be about 3 different theories of that would explain this data. One would be that maybe 4, that the coronavirus is more prevalent among populations that have a higher number of people living in the household. Explanation number 2, more prevalent among populations that have to work more often and have had to work in higher amounts through the lockdown. Third explanation, which I'm sure is someone in South County came up with, which was that there is less of an ethic of mask wearing in the North County. That's a possible explanation, but I'm sure it wasn't a North County person who came up with that theory. And maybe 4th would be associated with other health preconditions. So tell me, which of those 4 do you feel have significant factors in this?
Supervisor Williams, through the chair, those are really four great theories as to why we see higher rates of disease in our lower socioeconomic, and they all have good foundation. So when we compare and this is actually more applicable discussion for after the Santa Maria presentation.
Sure,
But
you can wait,
Okay.
wait till that then.
yeah, so I'll take a rain check on that.
Okay, we'll come back. Any other questions at this point in the presentation? Okay, seeing none, let's keep going. Thank you.
Great. So we also did an in-depth study into our Santa Maria confirmed cases, and the data is as of May 27th. So the first cases of COVID-19 in our county were identified as belonging to residents who lived in North County. Over the past several months, Santa Maria continues to see elevated cases. And in order to better understand why that was happening, we began an in-depth retrospective survey with the confirmed cases. And so what that means is that our team called the cases, the confirmed cases, and asked a series of questions that gave us some indication about the family, about the living situation, the work situation, in order to understand why we were seeing the higher disparate number of cases in Santa Maria. So this is just to give you a context of the burden of disease in our county. So even what we're interested in today is giving you an in-depth look at the what's happening in Santa Maria. So if we look at the map of Santa Maria, we see that the orange square represents active cases from 15 to 19 cases, with the a little bit darker orange down here as having cases of anywhere between 10 and 15, with the lightest cases 1 to 5. So you can see that the burden of disease is all over Santa Maria. However, the density, if you will, of cases is not in this main corridor. And this main corridor is north of Betaravia and west of Broadway. And these neighborhoods typically have apartments and residences with crowded living conditions. And we also note that this area, the darker colors, the reds, the dark orange, the dark, what would you say, this darker pumpkin color, these are representative of areas that have more congregate settings, such as skilled nursing facilities, long-term care facilities, shelters, treatment and recovery facilities. The data source are cases who have agreed to be interviewed, and so that would be 344. We made contact with 344 cases. And so of the people that we interviewed, 134 were in Santa Maria, and 210 were not in the Santa Maria cases area. With regards to race and ethnicity, you see that in comparison of Santa Maria cases versus non-Santa Maria cases, there is a disproportionate representation among our Hispanic and Latino population. With regards to the representation of Hispanic, Latino cases as compared to population, we also see a overrepresentation by about 42%. Age comparison. Santa Maria cases versus non-Santa Maria cases, we see a younger population among Santa Maria cases. Gender comparison between Santa Maria cases versus non-Santa Maria cases, we see higher, a little bit higher in female versus male. Primary language comparison between Santa Maria cases versus non-Santa Maria cases, we have a lower number who identified English as the primary language versus higher group who identified Spanish as the primary language. What was interesting to us was that from the get-go, when we saw a high number of cases in Santa Maria, and also with the higher hospitalization, we were worried that wanting to make sure that all of our health education, all of our public information that we were pushing out were linguistically accessible, and we made sure that what we were pushing out were not only in Spanish, but were available, interpreted into Mixteco as well. Education level comparison. We see that the Santa Maria cases, when looked at versus non-Santa Maria cases, there was a lower higher education attainment in our Santa Maria cases compared to non-Santa Maria cases. Annual income of Santa Maria cases versus non-Santa Maria cases, we see the highest bar being in the $25,000 to $50,000 level, with the other high bar refusing to answer. Household size comparison, and this is what Supervisor Williams had alluded to earlier. We see that among our Santa Maria cases versus non-Santa Maria cases, there were a higher number of our Santa Maria cases reporting a larger family grouping. With 27 being reporting there were 5, 22% reporting that there were 4 in their household. And in with 6 household members, 16% reported as such. What was noteworthy to us, which we hadn't seen in any of the state demographics, was we were also curious and somewhat worried about, could the place of employment be a driver of infection? So we did ask in our survey places of employment, and we found that 20% were farm workers, with the other high number being healthcare. So that's 7% with direct patient care and 4% non-patient care, and with 4% in government. And in addition to that, we saw 8% identified as being part of the prison staff, with 11% saying that, reporting that they were unemployed or disabled. So what this tells us is that a good amount of our Santa Maria cases were essential services workers. Additional occupation information. So the previous slide showed occupation data from cases who agreed to be interviewed, but we also, another source of information is from our disease control investigation staff, who speak with the cases nearly on a daily basis or frequently during their isolation and quarantining period. And what we found was that as of June 11th, nearly 26% of the cases that we had identified themselves as being farm workers. So the key data findings for this retrospective survey, insurance coverage, 73% said yes, they were they had some form of insurance coverage, whether that be public or private. And 87% stated that they heard about COVID-19 from the TV. 27% said they somewhat knew about COVID-19, with 34% said they knew moderately about COVID-19, and 20% saying that they were extremely knowledgeable about COVID-19. So we asked this question to understand about the community's understanding of COVID-19. We also probe for knowledge about hand washing and social distancing. So 92% of the interviewees said that they understood the importance of hand washing, and 70% understood the knowledge around social distancing. With knowledge comes the question, if you know it, do you practice it? Or do you have the capacity to practice it? And 72% said yes, they were able to practice social distancing at home, and 52% said that they were able to practice it at work. So that still is worrisome, because it leaves a significant number who are unable to practice social distancing at home or at work. Our findings, Latinos and Hispanics in Santa Maria represent a disproportionately number of high cases compared to their representation in Santa Barbara County population, and in comparison to non-Santa Maria cases. And when we compare non-Santa Maria cases and Santa Maria cases, we found that Santa Maria cases have higher percentage of household size between 4 and 7 individuals, and have more cases who were uninsured and less cases with private insurance, but are more likely to understand and practice social distancing at home and at work. So the next steps is we need to continue to partner up with various agencies to ensure that health insurance coverage and access to health care is available. And we need to continue increasing our preventive messaging in various mediums, and to also engage in partnership with employers on preventive measures, and engage the Santa Maria community in strategies to decrease the spread of disease. And I will pause here to see if the board has any questions. And this is, I'd like to get back to the comment that Supervisor Williams made earlier, which is, are the high cases due to bigger households? Are the higher cases due to working in higher risk environments, or being essential workers? And are there less adherence to face covering? And is there a higher prevalence of other underlying health conditions? And I would say that with regards to testing positives, yes. So like other jurisdictions, we are seeing that communities who have to work, who are out and about on their way to work with lots of exposures, either taking public transportation or in workplaces interacting with the public, populations or those communities do have a higher incidence of positivity. We also know that in communities with higher crowded living in one household, there are more likelihood of higher positivity. Is there less face covering in North County? Anecdotally, I've heard that, I've seen it, but scientifically, is there a rigorous study that can attest to that? At this point in time, we don't have that. And are there higher, is the population in North County at higher risk or have higher comorbidities, chronic disease conditions? And yes, so I think in an earlier update, I did disclose specific percentages comparing chronic disease prevalence in North County versus South County.
Thank you, Supervisor Williams. Did you have any additional questions? Okay.
I do. Lavanino.
Thank you, Supervisor Lavanino.
Thank you. And I am trying to figure out where we are in the presentation as far as I don't want to jump ahead of something, but I do want to ask about, I'm curious just as why we took a universal approach to, we were looking at all of the cases, and a lot of these people are going to get the disease or get the virus and not have to move to the hospital. Are we going to do this same sort of breakdown of people that are actually hospitalized so that we would be able to look at, I think what would be really helpful is to look at what is causing some people to get the virus and for some reason they get extremely ill and are hospitalized and in the ICU, which is what we have to avoid, as opposed to just the person out in the community that happens to get sick and is able to recover at home. So is there any data that is telling us, it's pre-existing conditions, or it's somebody that hasn't been to a doctor, or, is it somebody with cardiovascular disease or overweight or diabetes? What else is there that's telling us these are the people that are actually going to the hospital, these are the ones that are impacting the healthcare industry, and these are the ones that this is what we have to avoid?
Supervisor Lavanino, through the chair, we can definitely come back with more precise numbers about risks of hospitalizations, but from CDPH and other published reports, typically people who are older and or people with underlying chronic conditions or medical conditions typically are higher risk of being hospitalized. Our numbers
so that's kind of what I was, I'm sorry, go ahead.
Sorry. So our number, even though, so off the top of my head, I believe that we're in the 50s. So our numbers are quite small to do that precise study, but we're more than happy to come back with the hospitalization data from us as a state or as a nation for a future board update.
Well, I'm okay. Maybe because the sample size is so small, but what surprised me was, I think the message that I heard in the community pretty much was that, this was something that was going to attack older people at the beginning. That's kind of what we heard. And then our largest in Santa Maria, our largest segment is people 30 to 49. That's 43% of the people. But I'm curious, is out of that 43% of those people that got that from 30 to 49, how many of those were actually hospitalized, as opposed to 20% are people 50 to 69, and are 100% of those people being hospitalized? So is it, we could go out there and spend a bunch of time trying to educate a bunch of young people about what to do, when the reality is, even if they get it, it's probably not going to be that big of a deal, as opposed to it might be a small percentage of people that are older that get it, but if they do happen to get it, they have a very high percentage of being hospitalized. So it's just kind of interesting how we present that.
Right. So if I hear you correctly, you would like to have a profile for us to dig deeper into our hospitalized cases, the demographics, and see who they are. But Yes?
I just think that for me, after all these numbers that we've been hearing over and over and over again, and they're important, but I'm starting to figure out, at least in my mind, that it's hospitalizations and ICUs.
Right.
And that's what we have to, in my mind, it seems, that's where the focus and the precise information needs to be on how are these people getting to this point.
Sure.
Because not everybody gets to that point.
Right. But so I will come back with, the team will look at our hospitalization cases and develop a profile. But the thing is, though, I think a more comprehensive prevention message does need to look at the community-wide, because while younger people may be positive and not get too sick, they can spread it to more vulnerable members of the community. So that is what I would worry about.
Good point. The last point for me is, I think the takeaway is that we're talking about going out and doing more outreach. This study, I think, shows us that 87% of the people had heard about coronavirus. They had a pretty good understanding about social distancing and hand washing. And I mean, I think it would be hard to go out and find somebody, even in Santa Maria, even in one of those hardest hit neighborhoods, to go in and ask if you hadn't heard about it and what you need to do. I think everybody knows what they need to do. Whether they're able to do that in the job that they have is the big problem, or how they get to their job. Do they have to, a lot of people ride to work together here, and they have to work in close contact with each other. So I'm not sure more education is the answer. It doesn't hurt, but I'm just not sure how effective that's going to be as a strategy.
And I totally agree with you. I'm heartened by the fact that the community knows about social distancing and hand washing. And I think that that is a second level that the team had talked about. What do we need to do to engage employers in creating a safer workplace, and whether do we need to support employers in public transportation, limiting the sizes of carpools and whatnot. A particular interest to me is the cluster of cases among farm workers. So I did reach out to our ag commissioner to see if she would be open to partnering up and sharing or engaging the ag community to how do we support the producers, and how do we support the farm workers. So one of the things that we are planning to do is to share this information with the Santa Maria City Council and employers and stakeholders and the community to say, what can we, how can the Public Health Department, how can we as a county support North County areas in the control of the cases, in the incidence of spread.
Thank you. Are there other questions at this point? Let's continue with the rest of the presentation then. Thank you.
My third briefing has to do with the California Department of Public Health monitoring status. As I've shared previously, that the state is monitoring all counties as we are reopening for elevated disease transmission, increasing hospitalization, and limited hospital capacity. So the threshold is for the state, that the state has set, is we will need to have for Santa Barbara County less than around 675 average tests. So if we don't meet that, then we are in the danger zone. So as of yesterday, we have only achieved 99.2, but I want to say that there is, this has more to do with a lag in the platforms, the reporting platforms, and I think I've shared this with your board before. So when you see our metrics reflecting a low number, it is because of a lag between the electronic lab reporting system and the CalReady platform that the state utilizes. So that is something that the state is aware of and is working with the two systems. We did receive a green check mark in the elevated disease transmission category and in the limited hospital capacity, showing that we do have hospital capacity and that we're still okay with our case rate and our testing rates. However, we did receive a red number in our increasing hospitalization. So as we have exceeded the 10% change in 3-day average of COVID-positive hospitalized patients. As of yesterday, the state noted that we had 31.5 as our percent change in the average. What this means is that we will be meeting with the state tomorrow, the team, to talk about the drivers of these, the increased hospitalization, and what are our next steps in addressing, maintaining a stable hospitalization. So I did reach out to the state. I've assembled my team, and I have been in contact with the hospitals, and one hospital in particular, about the increased admission in that hospital and probing to see what were those admissions. Are they Santa Barbara County? Are they out of county? And so we will be in conversation with the state, and we will be monitored until we get a green checklist. So what this means, the impact is, as you know, the governor did release the last of the personal care sector to be targeted this Friday to be reopened if our local data meets it. And so we have been in discussion with both SLO and Ventura about our respective numbers, and we are hoping to have some conversations, further conversations today, and reach a decision by tomorrow. Are there any questions before I move on to the next update?
And just to clarify, Dr. DeRenoso, Ventura is also in the same situation we are, Ventura County.
So they got lifted after a week, I want to say a week and a half, maybe less, they got lifted. So it's a daily monitoring, and I actually asked Ventura how the process, and Ventura said they enjoyed the conversations, the dialogue with the state, and just the support in getting data, in looking at our systems, looking at our reopening efforts, looking at how can we engage partners in that shared responsibility that I've talked about. However, even though CEO Miyasato, even though they are not on the watch list, they are supportive in the delay by a week as well of reopening the last portion of personal care. Previously, the board requested information about deaths among Santa Barbara County residents from January through May, as reported on the finalized death certificate. And so we were asked the frequency, the number of deaths caused by cancer, heart disease, Alzheimer's, stroke, chronic lower respiratory disease, unintentional injuries, diabetes, chronic liver disease, cirrhosis, and kidney disease. And here are the numbers that we reviewed, and really want to thank Ms. Kane for being able to review the death certificates. These are preliminary data, so I appreciate her being able to do that amidst everything else. I put that into a graph just so that the board has a sense where COVID deaths fall into the what we see typically among deaths. And so cancer is still the top with COVID-19 for this short time frame, being right here above kidney and chronic liver disease. However, I want to pause here and say that we are very fortunate as a county because other counties don't see this lineup. And so this is a lineup from nationally. So this is a comparison of COVID-19 and common U.S. causes of death, with heart disease being the number 1, cancer number 2, and COVID-19 being the number 3. So even though during this time frame we see that COVID-19 comprehensively or collectively lands on the 3rd, there were weeks during this time frame that COVID-19 deaths in some jurisdictions, in some areas, was the number 1 cause of death. So I am grateful and thankful that we live in a community that doesn't see this.
Cancer. Mr. Chair?
Yes, Supervisor Adams, it sounds like you wanted to comment.
Yeah, I started before I should have. And I just want to thank Dr. Del Reynoso for contextualizing that data a little bit and make the observation that, we will always have heart disease and cancer with us, and COVID is going to subside at some point. So, keep that in mind.
Thank you.
Great. And with that, I know that Supervisor Hartman requested information regarding the prison, and we are still working on that. So that concludes my update from the Public Health Department.
Thank you, Dr. Del Reynoso and Ms. Kane, and thank you for your colleagues at the EPI unit too for working hard to put all that information together. I know that was a big job, so thank you. And then I think we have Ms. Anderson.
Do you want me to do it?
Good morning, Mr. Chairman and members of the board. I'm here to provide you a brief update on the RISE business activity since the last meeting. So the recovery update for this week is that we've had multiple changes from the state that we've incorporated into our process. We've had 11 sectors added that were effective June 12th. One sector is pending, that's the personal services as indicated by the Public Health Department. That is going to be delayed a bit. But the state was indicating it could be effective June 19th with public health officer approval. They also updated some the places of worship for expanded services in outdoor areas where they were limited to 25% or no more than 100 folks within their inside facilities. Public Health also issued their public health order 2020-12. This is related to the June 12th supporting of those sectors, the 11 sectors from the state. So where are we now? We have moved actually for the County of Santa Barbara from stage 2 sectors that is part of the Governor's Resilience Roadmap into stage 3. So the 11 sectors are listed there, and the pending personal services in the next couple of weeks. And there's still some indoor playgrounds, live theater, saunas, nightclubs, and the bigger venues that are still holding for state guidelines. This is just a reminder that we are keeping the RISE Guide updated. It's a living document. The last posting was June 15th, that was Monday. To incorporate all these sectors that posted on Friday. Our reopening process includes a self-certification online process for all of our businesses. We've had numerous businesses taken advantage of this opportunity. They are required to review state and local guidance, including the health orders that are issued, complete their plan template, a checklist, and self-certify that they can open safely. So here's the numbers for this week. These are as of Friday. We have 2,645 businesses that have submitted county-wide. We've had 2,240 cities and 225 unincorporated businesses. That's about 45% of our unincorporated anticipated businesses. And here are the top 10 industry sectors. Dine-in restaurants and retail continue to be our main leaders in this area, but we also have some new ones. Beverage industry was just added as of Friday. We've had 63 businesses submit online to reopen for that. We do have our RISE ambassadors out in our community, helping businesses, making sure that they're aware of the resources available to them on our website, and just introducing themselves and answering any questions they may have. Our goal is to make sure that our whole community opens safely, so that our community is safe. The Small Business and Community Partnership Enhancement Programs, we have actually 2 phases. Phase 1 includes the public rights-of-way, headed by our Public Works Department, and we have about 4 applicants submitted so far. Phase 2 was just posted online last week and is going to be heard by your board on the next item for finalization, but is for private property and parking lots, et cetera, that businesses may expand into. All of this information is available online. Here are the snapshot of our Recovery SBC website where all the information resides. It is in one central location for the ease of businesses to find the information that they're needing. And our information is as indicated on the website, but we also have an EHS admin at sbcphd.org email that our EHS team is fielding any questions that the public may have in regard to their businesses. They've been extremely helpful in answering kind of gray area questions, and they have a response time of less than 48 hours. So anyone who has questions they're happy to assist them. And that concludes my report. I'm happy to answer any questions you may have.
Thank you, Ms. Anderson. Are there questions for Ms. Anderson or comments to staff? Supervisor Hartman.
I just have a general comment because I'm getting, or question, a lot of requests through email about various kinds of cleaning, sanitizing, COVID hygiene products. I assume we don't recommend or review anything to the private sector. Do we have a process internally for how we review products and keep up to date for what we do within our county building?
Supervisors, so we refer businesses to the CDC website that has the approved product list, and that's what we use. There is a product list, and I believe it might be on one of our websites. We can get that out, but that's what we use, just the CDC approved list.
And I
have a question.
Supervisor Lavanino.
I'm sorry. I have a question about wineries. So I understand that the food requirement, if you could just explain what the food requirement is, if there is still one, and in particular, if people are allowed to bring outside food, if the business allows it.
Multiple answers, but I'm thinking that, and I don't know if Lon's here anymore, but she may want to add into this, but it was allowed through our EHS department that wineries who typically don't have a food permit could temporarily provide a connection through contracting, either through a food truck or a restaurant, to allow for serving of food. That was allowed them to qualify as a dine-in restaurant. Because they are now a sector that's open, they don't need to do that, but some had the interest to continue through the COVID-19 temporary crisis. So we are allowing that to continue until the event is over, essentially. In regard to bringing in food to locations, it is my understanding that's been past practice, but and our public health director is indicating that is still an allowable process. So hopefully that answered all your questions, Supervisor Lavanino.
Supervisor Lavanino,
It did, and that's what I always expect of you, Nancy, so thank you very much.
just a reminder, that's on your next item as well.
Mr. Gazzani.
That was my comment also, that when we go to the next item, we'll be discussing some potential protections that the board put in place in case there are changes at the state level.
Thank you all. CEO Miyasato.
Supervisors, if Dr. De Reynoso is still here, I know we had received questions about our SNFs. If she, and I think she didn't mention it, but I believe we had some questions about that.
Yes, So I'd like to give you an update on what's happening at our Country Oaks skilled nursing facility. The department has been working very closely with state agencies to address the outbreak, which started on May 31st. So we have our disease control team assisting with the disease mitigation and our medical ops team supporting the operations, as well as serving as liaison with state agencies such as the Emergency Medical Services Authority, the California Department of Public Health, Center for Health Quality Programs, Licensing and Certification Unit, and Healthcare Associated Infection Program. So it's a multi-agency effort. I am grieved and sad to report to you this morning that there have been 3 additional deaths yesterday, so bringing a total of 5 deaths associated with this facility. So as of now, we are reporting a total of 28 cases in that facility, 13 staff and 25 residents. This facility is at critical point as they have been met with significant staffing challenges. However, in partnership with the county and the state, we have deployed the following resources. We do have 2 teams from the state specializing in COVID positive care and response, each comprised of a nurse, 2 EMTs known as CalMat team. We also have Health Corps, a state-run medical staffing services designed to support counties' need during the pandemic, and they are filling some staffing gaps, nurses and PAs. The registry staff, the 3rd group, are filling in with CNAs, and also our county's Volunteer Medical Reserve Corps has been assisting. So we are closely monitoring with the state agencies, and we are working in close partnership with the facility as well, with the goal of making sure that this becomes a safer environment and that staff feel safe working there, as well as the residents who are there. And that concludes my update.
I have a question on that.
Supervisor Lavanino.
Thank you, Dr. Reynoso. So of the 5 deaths, were those all residents or were some staff?
No, they were all residents.
Okay, and then I think you had said 28 cases with 13 staff and 25 residents, but was that 38 cases, or did I get the numbers
You know
wrong?
what? I did my math wrong. There are total of 28 cases. And I will
So
verify.
13 staff and, okay. Yeah, that would be helpful. Thank you.
Yes.
Any other questions for Dr. Del Reynoso? Do we have some public comment on this item?
Chair Hart and members of the board, yes, we have 4 requests to speak on this item. And we are first going to the phone with Dr. Melissa Smith, to be followed by Anna Marie Gott.
While we wait, may I update? So that is 37 total cases, Supervisor Lavanino.
Thank you, Board of Supervisors and County Clerk. I'm Dr. Melissa Smith, Director of Health Equity Initiatives at UC Santa Barbara. I would like to highlight the importance of having a deep understanding of the data regarding the impact of the COVID-19 pandemic on the community in Santa Maria. As a physician who has worked in Santa Maria with indigenous farm workers, and as the interim coordinator of the Latinx and Indigenous COVID-19 Response Task Force, I think it is critical to understand how this pandemic impacts all communities, and in particular, those who are part of the essential workforce and those who are more vulnerable to COVID-19 or otherwise disproportionately impacted. I also served as chair of the expert healthcare panel that created the RISE document to guide reopening efforts in Santa Barbara County. All of these experiences inform my analysis of the priorities of our county's public health efforts. I would like to emphasize 3 points about the value of the data and how it can inform our collective efforts to have an impact and protect the health of everyone in our communities. First, the demographic data related to Santa Maria is useful in guiding prevention and intervention strategies to reduce cases, hospitalization, and death. Second, policymakers and community stakeholders need to convene, reflect, and analyze this data in order to create solutions that will mitigate the disproportionate number of cases in Santa Maria. And third, uncontrolled cases in Santa Maria may affect our efforts to reopen Santa Barbara County. Thank you so much for your consideration and for your support of this important collaborative work.
Thank you very much, Dr. Smith, and thank you for your insight and your willingness to help us address this issue.
We will now go to Anna Marie Gott.
Board of Supervisors, I have a few observations from hearing the report this morning. One is we are looking at a primarily Hispanic population that is being tested positive. Two, many of these individuals may be our essential workers. I'd also like to make an observation of where our testing site is in Santa Barbara. It's at Earl Warren Showgrounds, which has no access to an MTD bus stop within a half a mile because of the fact that we've had to shut down many of our bus routes. If you were coming from the west side, you would have to walk 1.9 miles to actually get to the testing site after you took a bus ride. If you were trying to go from the east side, you would actually have to walk another half a mile once you got off the bus. And in both cases, it's an hour bus ride. We already know in the city of Santa Barbara that most of our Hispanic population lives on the east and the west side, but they don't have easy access to any testing site. I really urge you to move the testing sites to ensure that the testing sites are readily available to those who are dependent upon our busing system and who may not be able to get to Earl Warren Showgrounds or any other location because they don't have access to a vehicle. They may not be able to bring their entire family with them because they have to watch young children. And what we need to think about, too, is that if these individuals are essential workers, they may be spreading the disease. Thank you.
Thank you, Ms. Gott.
We will now go to public comments submitted by Dr. Jesus Witten. Regarding COVID-19 policy, it's really important we get it right, and policy should reflect actual science, not baseless fear. Every prediction the CDC and WHO made about the dangers of COVID turned out to be wrong. We now know the science with a high degree of certainty, and policy should reflect that. The facts are, 1, children have an extremely low probability of complications, and there's no evidence they transmit COVID-19 to adults, not a single case. 2, there's no scientific justification for children wearing masks in school. Surgical masks are designed for sterile environments. Surgeons replace them every 30 minutes, and if they touch the mask, they immediately have to re-sterilize. 3, the initial predictions were 2 million American deaths and 3 to 4% mortality rate. The death rate ended up being orders of magnitude lower, and the fatality rate is 0.26% and 0.03% for people under 50. 4, there's no scientific justification for an emergency order to continue or for children to wear masks in school or anywhere. Masks are ineffective, unnecessary, and even dangerous. 3 Chinese children died from running at school with masks on. Unless you can provide science indicating a real and imminent threat to health or that the hospitals are beyond capacity from the so-called pandemic, you are committing fraud to allow the emergency order to continue. The health officer, by law, must provide the science to the Board of Supervisors to justify his orders. Dr. Witten.
Thank you, Dr. Witten.
And we will now go to our final speaker, Lee Heller, on the phone.
Chair Hart and members of the board, this is Lee Heller. Good morning, and I want to begin by thanking Supervisor Williams for asking the questions I would have asked during the presentation, and to Dr. Doso for having already anticipated them and covered them so thoroughly in your detailed breakdown on both demographics and what underlying causes are that results in the outcomes we are seeing. I want to add something that I hope we are all thinking about, which is where people live is not necessarily where they work. One of the issues is the fact that 2% of people don't feel able to practice social distancing in the workplace. Then we have to look beyond to look at where exposure might be and help businesses to do a better job in protecting essential work. Just going around South County, and I've been up in North County a little bit, I am failure to comply, as we shall say, with both physical distancing, keeping 6 feet apart, and with face coverings in a variety of businesses, including businesses that you wouldn't expect, like my veterinarian's office. And I think it's really important that there continue to be aggressive outreach and education to all to help them understand that it's their employees' health that is at risk. It's not just those of us who are consumers, but the people in these workplaces all day that may be exposed by lax consumers, but also by their colleagues. So maybe more aggressive outreach and support to businesses and ambassadors, and I'm always willing to be one. So thank you again. I'm sure we can address this problem and find a way to make things better.
Thank you, Dr. Heller.
And that was our final speaker.
Thank you. Are there additional board comments or questions? I guess I'd just like to say that the increasing hospitalization numbers and the information about the skilled nursing facility outbreaks are very sobering. And it's a reminder that we're not done with COVID-19 and that the virus remains a threat both to public health and to our economic recovery. The good news is that from the information that the Public Health Department has gleaned from their survey, that a really large percentage of people understand what we need to do. The personal strategies remain the most effective, wearing face coverings and washing your hands and not touching your face. Something that I think is an increasing challenge is as more businesses are opening and people are going back to work, there is pressure on folks who may potentially have symptoms to work, and that is a tough challenge to ask people to not go to work when they are feeling symptoms. But that's really important. We can't have that happening. The other good news is that the voluntary testing rate continues to be very strong at all the locations, and that's something that also isn't easy. People have to step up and do that. It is free, and it's pretty darn convenient when you get down to it, but maintaining that is important for us to be able to track the virus. The RISE ambassadors are doing a very good job of working with businesses. They're well received. Those interactions are positive and helpful. And the more we can do of that, the better. As Ms. Heller mentioned, some businesses are doing a better job than others, and having those ambassadors provide that information and help tighten up those systems, make sure employees are safe as well as customers is really important. And I'm very hopeful that the new collaboration that we're proposing in Santa Maria with community organizations and local government partners will create some new creative intervention strategies and communication strategies that will help change some of the trends that we're seeing. It's not just a matter of communicating the need to do this, but it is the reminder that we all need to continue practicing that. It is easy. I personally struggle with this all the time. How often is enough to wash hands? Don't touch my face. That's something that gets easy to slip up on. So a constant reminder all the time is part of what we're trying to do here. So thank everybody for all their work, and we'll hope things turn around soon in the right direction. Supervisor Williams.
I just was inspired by your words to echo them and say that You know, because we don't completely know whether people are getting it more at home or at work or on the way to work, there is some level of uncertainty. And in the area of uncertainty, it just becomes crucial to practice very stringent personal responsibility, even when it may be an issue like mask wearing that you find irritating. I find a lot of the rituals that we go through irritating and sad in some ways, but we've got to keep with the program because we're not out of the woods yet, and the continued opening of the economy depends on us having that personal responsibility. People's jobs and livelihood depend on that level of responsibility, and people's lives depend on that level of responsibility. So I just urge that if we all take those steps of responsibility, including and especially staying home when you are experiencing symptoms, that we can come out of this okay.
Thank you, Supervisor Williams. Is there a motion for this item?
So moved.
Motion's been made. Is there a second?
Second.
And roll call, please.
Chair Hart, members of the board, just for clarification purposes, that is approving recommendations A through C on today's agenda.
Madam Clerk, could you please call the roll?
Mr. Adam?
Aye.
Mr. Lavanino?
Aye.
Mr. Williams?
Aye.
Ms. Hartman?
Aye.
Chair Hart?
Aye.
Motion passes unanimously.
We'll take a 10-minute break and then come back for departmental item number 2.